nurse's wardrobe. Now, let us now look at how do we carry out this wardrobe. So, pre-wardrobe preparation. First of all, if you want to carry out your wardrobe, you have to review patient charts. Come early in the morning when you spoke to your members. Okay, let us look at the patient chart so that you familiarize yourself with patient medical history, current condition, and treatment plans. What has been prescribed for this patient. You look at it, what and what has been served. You look at them. Then other relevant information. Collect relevant data such as vital signs, laboratory results, and medication list. Then next is you identify concern. Note any concern or issues that needs to be addressed during the whole round. Now, this is talking about when you are carrying out your own whole round as a nurse. You look at what are those issues that when the general ward round is being conducted between the doctors and what are those issues that as the ward round is going on, you can quickly chip in that during our own ward round, this is what we've been able to find out so that it will now give the medical team the informed information that we've received so that they will now carry out the appropriate measures to tackle whatever issue that is wrong with the patient. Nurses all around is very necessary because of the key role it plays in providing comprehensive patient care. Since the nurses are responsible for monitoring vital signs, medications, and overall condition of patient, the one round enables them to closely observe patient and quickly identify any change or concern for possible intervention. This is just what I've just earlier mentioned. Now, conducting the ward round. Now, how do you conduct the ward round as a nurse? After you've done the pre-ward round preparation, now going to the main ward round. First of all, as you go close to the patient, you do introduction and rapport building. Introduce yourself, of course, to the patient. Explain the purpose of the round, and then establish rapport with the patients and their family. As you're about to start, make sure that you introduce yourself and then establish rapport with this patient. We have situation where these days we hardly our colleagues, our younger ones these days, they hardly even interact with the patient, which is very unfortunate. They just sit at the nurse's table, only goes to the patient when the time for medication to serve the prescribed drug, and that is all. That is the only time that they go close to the patient, which is not good enough. And that is taking, you are relegating your role to the background. Gone are the days when a patient, when you are going in the public, maybe in the market or in the motor park or just on the street, they'll just call out to you. And you don't, if you're forgetting about them, they'll go to, thank you for that time. Oh, now you'll be wondering because that's happened to us. Some of us, the older ones, people just be appreciating what you've done earlier, but hardly do this type of behavior now happen. And that is because in those days, we make sure that you are close to your patient, you move around, you go along with your senior colleagues to carry out ward round. During the ward round, you interact with your patient and the patient get to know you, and then you know the patient as well. So we need to go back to that good old days. And then patient assessment. Assess the patient's condition, including physical, emotional, and psychological need. As you carry on your ward round, you make sure you assess this patient properly. Because, like we earlier mentioned, it is not only the condition that brought the patient to the ward or that made the patient to be admitted that is disturbing the patient. There might be other underlying issue. The scenario which I've just earlier discussed with you with that hysteric patient is very vital because you can have a situation where just you talking to the patient, discussing with the patient, counseling the patient is the treatment that that patient needs. They may be having some family problem, social problem, which is weighing them down. And then gradually, due to depression, they will present with a lot of signs and symptoms that will mimic other disease conditions like malaria, whatever, typhoid, and then they'll be admitted. But along the way, when you interact with this patient, you'll be able to find out that the patient only needs counseling, and that is all. You've helped the patient. So you see how this word round is actually important to the patient care. Then collaboration with interdisciplinary team. Work with other healthcare professionals to develop and implement care plans. Then patient and family education. Educate patient and family about their condition, treatment, and self-care. In some cases, like we earlier mentioned, uh, a debilitating disease that is of permanent nature, like hypertension and diabetes, you need to closely discuss issues with the patient and then their relatives because they are not going to continuously stay in the hospital. They will, at the end of the day, be discharged home. And if they are discharged home, there is need for life change. And then there is the issue of medication. You need to involve the patient's family in such situation. Now, what are the key skills in nurses wardround? The key skills are as follows: effective communication. Now, as you are doing your wardround, you must know how best to discuss with your patient. Communication is key to the management of any patient. So clearly communicate with patient, their family, and then other healthcare team members. If you don't communicate properly, you are going to complicate the, the patient's condition. Let me give you another example. A patient might, come. We have a scenario of recent where a patient come, she registered with her husband name. Then at the end of the day, we look at the file. The file of the patient was carrying another person's name. So, and this patient is to be transfused. But all the documents is related to that same patient. But we are seeing another name. So we have to ask her, why do you have two names? It is the same name, but the surname are different. Why? She said her friends told her that she should not use her husband's name. She should use her father's name. But we are confusing the situation. So we have to be now, that was when we were able to, if we have not communicated properly with her, we'll still be searching who is the owner of that blood because she has used two names. So effective communication is very key. So we now have to communicate to the laboratory.